Morning everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much more. I'm helping everyone, especially those over 40, optimize their health, hormones, and metabolism so they can live a life full of strength, energy, and vitality. That's what I want for you, everybody to feel better about themselves. And that's what my clients are experiencing. They're waking up every day refreshed, full of energy, full of vitality and libido. They feel good in the gym, they're recovering, they're losing weight, their body's looking better, they're feeling better, they're giving back to others. So if you're interested in feeling that way, reach out to me. So little segue, I've been doing a little series on PCOS because I have a lot of patients and clients that reach out to me online and I work with personally who have this. It's a very common condition. If you missed the first couple, go back and watch those, and I'm going to continue on. So it's very important. It's a very common endocrinopathy among women, and it's something that persists throughout life. And again, the biggest issue is the insulin issue, and it comes first before the androgens. A lot of myths and different thoughts about this, and concerns like, oh my gosh, it's all about that testosterone, it's just too high, you got to block that or stop that or do whatever. That's really secondary. It comes before the insulin. And again, as I talked about, there are people who are overweight and there are women that are thin. They call it thin PCOS, right? And often, sometimes actually the insulin is not even elevated, but they still have insulin resistance at the cellular level and or other issues in terms of the endocrine function. So sometimes even the insulin at first will not be high. So you have to look for signs and symptoms. This is where the clinical acumen comes in, of a good discussion with your physician or practitioner. It's not just a checkbox, right? Checking for XYZ symptoms or XYZ lab. Sometimes it's a compilation of these things. You have to put them together and figure it out. But this is the biggest issue. Again, it's not just about the testosterone. Again, the treatment is directed at the end result, the end organs, right? It's at the pancreas, at the skin, the hair follicle. It's not the ovary. Again, it was a little bit of a misnomer because it's not all women have cysts, right? Even though it's called polycystic ovarian syndrome. Some of the original syndromes were called Stein-Leventhal syndrome, actually, and it had a different name. And again, so it's not just about going after the ovary. So again, we treat this specifically because we don't block certain things to affect, because at the hair follicle and at the skin, because this is where the end result is. These different elevations or abnormalities in certain hormone, and it affects the actual cell at the hair follicle. It's a sensitivity of the hair follicle to the androgens and to the insulin. So you treat actually the hair follicle and the skin. Same thing with the pancreas. Just like with insulin resistance and prediabetes, the effect is at the pancreas. You have to fix the pancreas and how it's receiving signals from extracellular environments, other hormones, other parts of the body. And again, why is this so important? Again, I want to harp on this. I'm big on repetition because it's key. And again, a lot of these women with insulin resistance, which of course can lead to a plethora of problems, right? A whole bunch of problems related to insulin resistance, as everybody's more aware of nowadays, getting on to prediabetes, inflammation, cardiovascular disease, cancer, and much, much more. Again, a lot of women have increased weight, irregular menstrual cycles, anovulation, and infertility issues. Sometimes it's the only thing we'll see is anovulation, and sometimes that's barely recognizable, basically with a history of problems getting pregnant or just irregular cycles or heavy menstrual cycles, and again, oftentimes coming at the wrong time. Hirsutism or abnormal hair growth in places, ladies, you know what I'm talking about, hair growth where you don't want it, right? Or acne and obesity. And again, the end result of all this is inflammation. And that's why I talked about some of these other things. Sometimes there's abnormalities and other things like aldosterone, or again, at the hair follicle or in the skin or in the pancreas, so there's inflammation. And again, that's a smoldering problem and sometimes can be missed unless you know what to look for. And then later on, you're going to have a problem, and it's going to lead to more of these other things. And again, even further, deeper, why is this even important? Again, of course, all these things are bad, but the biggest thing is all these women are at high risk of all this, right? High blood pressure, diabetes, cancer, dyslipidemia, or abnormalities in their lipid function, which of course can feed into high blood pressure, diabetes, and cancer, and cardiovascular disease. And of course, infertility. This is bad too. Of course, a lot of women want to have children and they can't. And again, the problems with lipids and the blood sugar, again, of course, can lead to cardiovascular disease, which I didn't write on here, but cancer especially. And a lot of this has to do because, as I talked about in one of the first videos, there's an imbalance of hormones and between progesterone and estrogen, and then because of that, there can be abnormalities in the lining of the uterus, which can lead to endometrial or uterine cancer, as well as other types of cancer too. So this is massively important. So we want to prevent that if all possible. So again, just like I talked about with my other hormones, it's obviously by correcting them, people are going to feel better, look better, but more importantly, you're going to have health issues that are addressed and prevented from happening down the road. Of course, we want to live better, stronger. We want to block all these things that can cause disease and death down the road. So I'm going to talk about more on the next time. So tune in. If you like this video, tag it, like it, share it. Please comment below what else you'd like me to talk about. I will gladly discuss it. Remember my mantra: live to give. Do something nice for someone and pass it forward. Let's make this a better world. Let's all come together and support each other, love each other, and help each other out. And that's what this country is all about. Everyone have an awesome day. We'll talk to you soon.